Dyson. Order. I've called the member's own colleague, the Honourable Ruth Dyson.
My question is to the Minister of Health. Does he stand by all his recent statements on district health boards?
The Honourable Tony Ryle.
Yes, including the statement that the government is investing the highest percentage of GDP on health ever, and at the same time, health boards are increasing their frontline services.
Honourable Ruth Dyson.
How does he reconcile his former outrage when he said in the House, quote, "What's the point of having whistleblowing legislation when someone does the right thing and speaks out for the community, but they get hunted down and taken out by the government's henchmen?" With his total silence on the muzzling of mid-central health staff in relation to health cuts in their region.
The Honourable Tony Ryle.
Mr Speaker, there have been numerous comments from health staff in the Mid-Central District Health Board area that one is aware of. What I can tell that member is that the Mid-Central District Health Board's getting an additional $13 million this year, bringing their total budget to $505.
The Honourable Ruth Dyson.
What does he say to the 120 people who braved freezing conditions in Palmerston North last week to protest against the health cuts? One of whom said, "The Minister said this isn't about cuts, but about change. I beg to differ."
The Honourable Tony Ryle.
What I would say to Mr Speaker, what I would say to those people, good people of Palmerston North, is that this government inherited a declining financial position at the Mid-Central District Health Board, with the deficit expected to be well in excess of $10 million, and we can't have assured services for the people of that community when there is a financial situation like that, and we're working to secure good quality frontline services for the people of Mid-Central.
Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health, does he stand by his statements about hospital emergency departments, particularly North Shore Hospital, where only a few years ago people languished under fluorescent lights on trolleys and corridors for up to 36 hours?
The Honourable Tony Ryle.
Yes, this morning at the North Shore Hospital, the Associate Minister of Health, Dr Jonathan Coleman, opened a new 25-bed ward. This new ward means that patients won't have to wait so long to be admitted, and this is in response to the government's 6-hour emergency department target. Next month, 8 clinical nurse specialists will start at the emergency department in North Shore, working in partnership with doctors to provide faster treatment in the emergency department. This is an example of frontline services that are improving all around this nation.
The Honourable Ruth Dyson.
How does he expect Mid-Central District Health Board to do anything other than make more health cuts when Treasury forecast health needing at least 5% increase to keep up with costs, and his budget handed Mid-Central a 2.12% increase in this year's budget?
The Honourable Tony Ryle.
Mr Speaker, the advice that one has received from the Ministry of Health is that in order to keep up with inflation and demographic change, the health budget would have had to increase by $509 million. In fact, in this budget, it's $512 million. And what I can advise the member opposite is that this is the highest percentage of GDP ever invested in health by any government in the history of this country. And for that, we are getting massively improved frontline services.
Question number 10, Rahui Kartane.
Mr Speaker, thank you.